All right, good afternoon. Thank you so much for spending your Friday or a little bit of your time with us Friday. I'm Lisa Jackson. I'm the Vice President of Marketing and External Relations at the University of Jamestown. And I am thrilled and honored to be here to introduce our speakers today for this press conference introducing new nursing programs at UJ. And so we'll get things started. We will have our speakers and officially open the press conference and a time for questions and answers afterwards. We are going to do a wall breaking and then we have some refreshments afterwards. So thank you for your time. I will introduce to you President Polly Peterson.
Well, welcome, and thank you so much for being here today. This is a very, very big day for us, something we've been waiting for over a year and a half, maybe stretching that into 2. As we all know, things take their own sweet time, and so this truly is a momentous occasion for us as we reintroduce the University of Jamestown to all of you in this vibrant Fargo community. For those of you who don't know, the University of Jamestown was founded in 1883. We were founded by very forward-thinking Presbyterians who understood the pivotal role that education plays in building communities. Our university has since been dedicated to providing a holistic educational experience that combines the best of the liberal arts with professional training. Throughout our 140-plus years, the innovation has been at the core of who we are. Today, we continue to embody that spirit of creativity and progress as we announce the expansion of our Fargo campus with 2 groundbreaking nursing programs. These programs represent a significant step in forwarding nursing education in our region. The first program is a stackable associate's degree in nursing program. It will offer flexible pathways for individuals seeking entry into the nursing profession. The second is the region's first direct entry master's program. This is a highly innovative new program. It is designed for individuals who already hold a bachelor's degree. And now they're looking to make a change and enter the nursing profession. With the support of a grant from the Department of Labor, these programs aim to make nursing education more accessible and affordable for all students in this Fargo-Moorhead region. Since 1946, when UJ launched the first bachelor's degree program in nursing in the state of North Dakota, the University of Jamestown has been synonymous with graduating high-quality, compassionate nurses. Our graduates have made valuable contributions to healthcare across the region and beyond. They have enriched countless lives through their dedication to patient care. We are deeply grateful to Sanford Health for their partnership in expanding access to clinical opportunities and employment pathways for nursing graduates for these 2 programs. We also extend our deep appreciation to our Jamestown partners, Ann Carlson, Ave Maria, and Jamestown Regional Medical Center, for their unwavering support throughout the past 2 years. I also want to thank our partners, RisePoint, who is here today, and they too were instrumental in helping us build these 2 critical programs as we grow nursing and nurses for this region. Today marks a new beginning for aspiring nurses who have long awaited an opportunity to pursue their dream of becoming a nurse. Whether you are a working parent, a career changer, or a first-time degree seeker, this program is designed with you in mind. Our commitment to providing a holistic experience in a Christian environment remains steadfast. Supported by dedicated teams of faculty, staff, and administrators, we will be by your side, ensuring that you can be successful. As we embark in this journey together, let us rejoice in the possibilities that lie ahead. This is a day of celebration, of hope, and of opportunity. With gratitude in our hearts and determination in our souls, Let us embrace this new chapter in the history of the University of Jamestown. As I've come to say over and over again, this is the day that the Lord has made. Let us rejoice.
Thank you, President Peterson. My name is Paul Olsen, and I'm the Executive Vice President and Provost at the University of Jamestown. I have been a professor or an administrator in higher education for nearly 20 years. Before that, I was the dreaded teaching assistant for a total of 5 years, teaching courses in religion and sociology. Before that, I taught high school for 2 years. And I also have 3 teenagers who have told me a lot about their educational experiences recently. At no point during my experiences in or with education have I ever heard anyone say, "I love group projects." Show of hands for everyone who likes group projects in school, right? Very few people, very few. When a professor or a teacher announces a group project, groans usually follow as the good students worry immediately about their grades and the effect that a bad teammate could have on them. And they jockey for position in groups that don't have free writers. Not only do students have to worry about getting the assignment done, but they have the extra work that comes with distributing tasks, getting stuck potentially with the part of the assignment that they really don't want to do, and the inevitable arguments that follow over the vision, the direction, and what the performance standards and quality expectations for the project ought to be. So why do we torture students by continuing to make them do group work if nobody likes it? Well, I would submit the last 2 years of work that have brought us to this point as the University of Jamestown as our Exhibit A. We wouldn't be here today without the help of dozens of people who participated in this ambitious group project. Those of you who have heard me speak before know that I love to quote the theologian Reinhold Niebuhr and say that nothing that we do, no matter how virtuous, can be accomplished alone. Therefore, we must be saved by love. We are doing something virtuous here today and with this project. We are addressing North Dakota's and northern Minnesota's nursing shortage head on. We are improving the quality of health care in the Fargo area in our own way. Jimmy nurses are not only technically sound, they are caring, compassionate, and they are outstanding patient-oriented nurses. We're doing this because we love our corner of the world and the people who live here. And we're doing it in an affordable way thanks to a grant from the Department of Labor and through the generosity of our partners. Partnerships, which is really in many ways just a nice way of talking about group projects, are a huge part of the future of higher education. This project wouldn't have happened without the participation of all of the partners involved. Sanford and all of their employees who have been a part of this project have been invaluable. Their, and particularly Teresa's willingness to help us overcome some of the barriers involved in nursing education, particularly as it comes to clinical partnerships or clinical placements for students, has been truly exceptional. Thank you for coming along with us on this journey. We are also grateful for our longtime Jamestown-based partners in nursing education, particularly Ave Maria, JRMC, and the Ann Carlson Center. They do amazing work in Jamestown, and we truly appreciate the relationships that we have with them. We also wouldn't be here today if it wasn't for our partners at Rise Point, who have been with us every step along the way for the last 2 years. Tom McNamara, Jason Ferguson, and Rodney Freeman have been particularly important as the project has progressed. And we're excited to add Gina Bellmare to the team just a few months ago to help students find the university's programs and become Jimmies. Internally, I've gotten the privilege of watching Dr. Kim Ash, the executive director of our School of Nursing, excel over the past 2 years and lead the development of the 2 of the most creative and innovative curricula going in our associate's and master's degrees in nursing, in addition to identifying the 2 newest Jimmy nurses who will run our programs here in Fargo, Dr. Beth Sanford, our Fargo site director, and Jennifer Jacobson, the associate director of the School of Nursing. Ultimately, For the last 2 years, I've been involved in the best group project that I can imagine participating in. And we have worked with dozens of people living and working in Jamestown, in Fargo, and in Sioux Falls, but also in places like Pittsburgh, Atlanta, Phoenix, Chicago, Austin, Seattle, and even a little town in Maine. It's been one of the best projects that I've ever worked on, and I'm looking forward to many more years of working with these incredible people as we do everything that we can to address the nursing shortage in the Fargo-Moorhead area in an affordable, creative, and high-quality way. Thank you all for being here today, and go Jimmies. And now I would like to introduce Teresa Larson, excuse me, the Chief Nursing Officer at Sanford Fargo Medical Center. Sorry, Teresa.
All right, thank you so much, Dr. Olsen. And I'm just excited to be here today. We've been working on this for quite a while, and it's so nice to see that we're at this point where we're really going to be opening up in the fall, and it's just been a great partnership. So I've really super enjoyed it, and it's very exciting to see the new nursing opportunities that are coming to Fargo. Together, I think with these new programs, they will bring flexibility into how we do clinicals, which is new for us. We often do clinicals that are kind of set in the same way all the time, but this program is going to offer flexibility, state-of-the-art clinical training. It will really help address the critical need of nurses and the shortage that we have today in the healthcare industry. We understand that many individuals face significant barriers when they're working on trying to get their career started, and these barriers are schedules and sometimes working out what is personal to them and how do they fit all of that together. And I think with this partnership with the University of Jamestown, we are going to be able to break through some of those challenges to be able to bring more students into our pipeline as well as into our University of Jamestown schools and programs. I think we will be able to, through this partnership, we'll be able to provide educational opportunities that will allow students to tailor that coursework and fit their clinical schedules together in unique ways. I think as we look at the flexibility that is essential in how nurses start their careers, again, this program is going to be able to foster that and be able to help these nurses come out with the understanding of the flexibility of what nursing as a career is. The flexibility will not only open doors, but will also reach and ensure that we have a diverse and adaptable workforce that's ready to meet the demands of healthcare that we have today. Our students, again, will be learning in the state-of-the-art clinical facility, which is behind us, and we're very excited for that. The facility will be equipped with the latest medical technology and simulation tools that will really provide the students with a hands-on, real-world experience in a controlled and supportive environment. This really ensures that the students receive the best training possible, preparing them for the demands of modern healthcare. Through this partnership, we are offering scholarship opportunities. This really underscores our dedication in investing in the workforce and empowering individuals to achieve their career goals. These scholarships will help alleviate some of that financial burden that can deter potential students, making a nursing career more acceptable to a larger group of people. Nursing shortage is a critical issue affecting many healthcare facilities across the country. Partnerships like this will play a vital role in addressing the challenges by creating more opportunities for individuals to enter the nursing profession. Through this flexible, accessible, and high-quality training, we're helping to develop the next generation of skilled nurses who are essential to delivering exceptional quality care. We're excited about the potential of the new programs to transform the lives of our students and improve our healthcare outcomes in our community. These programs will be more than just educational pathway, but they will foster a sense of family and community. Our nurturing and engaging atmosphere will inspire students to feel a strong connection to Sanford and our nursing family, encouraging them to build a career with us. The partnership is not only strengthening our educational offerings, but it also enhances our capacity to provide top-tier healthcare services. Together, we can build a stronger and healthier future for all. Thank you.
At this time, we'll have an opportunity for anyone who has questions to ask questions. And as a former professor, I'm perfectly happy with waiting until someone has a question.
How does one apply for a scholarship?
It's a part of the application process with UJ. And so the best way for students to apply for the program and for scholarships is to go to degrees.uj.edu. And there are links on that site that they can click on to then get them to apply for the program. And then Gina and her team will be in touch with them about the scholarship opportunities that are available. Yep.
About how many students will be in the program here, and if successful, are there plans to expand?
Yes, we do have plans to expand the program. Initially, what we're hoping for this fall is to have a group of 24 Associate of Science in Nursing program students start in late August. And then our direct entry MSN students more than likely will need to take some prereq courses, so they would start in the fall with the prereq courses. And then their nursing courses would begin in January. So in January of 25, we would like to start another 24 associate's degree students and groups of 16 direct entry master's students, and then start similar numbers next summer and into the foreseeable future. Okay, well, if there are no other questions, we have sheetrock to break. So